In 2019, a survey by NOIPolls found that 87% of Nigerians said they were healthy by their own assessments. 2 years later, the proportion of Nigerians who considered themselves healthy stands at 88%. So, falling ill and what to do about it is a worry for most Nigerians. The latest survey this year found 87% of adult Nigerians go to the hospital when they are taken ill. No increase at all since 2019. For the remaining 13% who do not go to the hospital, the choice is between going to a pharmacy, a chemist, a herbalist, and self-medicating.
I used to go hospital when I'm sick or when my family is sick. We have doctor that used to treat us.
Sometimes I take self-medication, which I know is not good, or I visit the pharmacy to get one or two this thing, or go get myself tested.
I have to go to the hospital myself. Nothing.
I don't get sick often, but if I do get sick sometime, I prefer resting.
I just go straight to my mom and she gets drugs.
It comes down to having access to health care and paying for it. Nigeria is on the train of universal health coverage to ensure every citizen has access to affordable care when needed. It established in 2006 the National Health Insurance Scheme, which at minimum covers up to 90% of healthcare costs for those enrolled on the scheme. More than 10 years since the scheme started, only 18% of Nigerians have any form of health insurance cover, an increase of 3% since 2019.
I have access to it. Somewhere I started enjoying the National Health Insurance Scheme from inception to date.
So you know more about the NHIS scheme?
Because it's a very good program.
5% of Nigerians have relatives and friends pay for them, but the remaining 77% pay out of pocket, a proportion that includes everyone from civil servants and professionals to self-employed and the unemployed. Worse still is some Nigerians either do not know or have never heard of getting insurance cover for their health, nor how to go about it. Laws backing health insurance mandates it for establishments with employees more than a threshold number. 15 years since the NHIS started in Nigeria, it has covered workers in federal civil service. Some states have adopted it or created their own versions for community health coverage, and health maintenance organizations have evolved a raft of packages to cover workers in private sectors. 47% of Nigerians, aside those already on the scheme, are not aware of the NHIS.
Have you heard about the National Health Insurance Scheme?
No, I haven't.
No, just hearing it for the first time.
Maybe on the news. Yes, maybe on the news. Yes.
Yeah, but I don't really know much about it.
Among Nigerians who pay out of pocket for healthcare, 57% say they would be willing to pay into some monthly or yearly contribution in return for access to healthcare whenever they're taken ill. But the lowest figures for those willing to buy into any health cover come from the South and Southeast, the same regions where awareness about the NHIS is lowest. In addition, among those willing to get some form of health cover, only 11% have any idea how to go about it.
Do you have an idea of how to go about the process of assessing healthcare insurance cover?
No, not really.
No, I don't. I don't even have the idea. I don't know.
No, I don't.
I don't really know.
15 years since the country instituted health cover, 7 in 10 Nigerians still pay for healthcare out of their pockets. Around the globe, that amounts to 930 million people spending at least 10% of their household income on healthcare, where every 1 in 2 persons in the world has no access to healthcare. The World Health Organization estimates around 100 million people every year are pushed into poverty on account of paying for healthcare out of pocket. To reverse this, the country needs to accelerate its push to get the health of more Nigerians insured.